Hello, everyone. Welcome back to another Women's Health webinar series, and we are into part 8, hormone lab testing. And my name is Heaton, and I am the Women's Health Clinical Liaison. So today we're going to talk about why hormone testing is important, the common hormonal imbalances in women. We're going to look at the key hormones to test for women's health. We're going to go over the types of hormone lab testing, the advantages and disadvantages, some lab testing considerations, and I'm going to share some hormone lab testing companies with you and what they provide as far as the types of testing. So the purpose of this webinar is to provide you with an overview of the various types of hormone testing for women. And hopefully this will give you some insight into the available testing options, their clinical relevance, and considerations for your patients. And this is a general overview only. We're not going to go in depth into the nuances of testing themselves or any case studies, but please look for future webinars on this subject and maybe a more in-depth discussion. So why is it important to test for hormones? Well, first of all, a lot of women come in with a myriad of symptoms, and symptoms alone is not always reliable. And testing really helps to give us baseline levels to be able to assess what's really going on internally. Kind of helps us to identify those organ system imbalances or fluctuations that symptoms alone can't reliably reveal. Also, hormone values can help guide practitioners to prepare a therapy plan that best fits a patient's unique imbalance or deficiency. So everyone is so unique in their chemical makeup and what's going on as far as deficiencies or hormone fluctuations that they're not even aware of. And it really helps to give insight as to what's actually happening internally so that we can come up with a good therapy plan that will fit the patient. So ongoing testing will be critical for monitoring the effectiveness of treatment and fine-tuning therapy dosages so that we can achieve those optimal hormone levels. So the most common reason why women need hormone testing is to correct symptoms of hormonal imbalance. And these are vasomotor symptoms like hot flashes and night sweats, heart palpitations, and changes in blood pressure. And this is all due to wide fluctuations in hormones and potentially other imbalances in the body as well, because the cause of hormone imbalance is multifactorial. And up to 80% of women experience these vasomotor symptoms during menopause, and a majority of women rate them as moderate to severe. And recent research from the Study of Women's Health Across the Nation, or SWAN, found that frequent vasomotor symptoms last a median of 7.4 years, which is actually longer than previously thought. But there are women who continue to have these symptoms 10 to 15 years after menopause. So let's go over some common hormonal imbalances in women. We're going to start with estrogen dominance, which is very common, and it is rampant. I feel like we are living in a sea of estrogen. And the majority of women, we can't help it. Environmentally, we can't help it. There's so much estrogen dominance out there, but basically it is characterized by levels of high estrogen relative to progesterone, and it is also known as unopposed estrogen in the medical literature. Hypothyroidism, which is, of course, an underactive thyroid, and basically women who are going through the perimenopausal stage generally have symptoms of hypothyroidism just because of the wide fluctuations in their hormone levels. They tend to have thyroid issues as well during that period of time. HPA axis dysfunction. So stress is a major problem in this day and age, and chronic stress disrupts cortisol production, and it leads to other hormonal disturbances. And then we have perimenopause and menopause, which are basically transitional phases in a woman's reproductive life. And it's basically characterized by wide fluctuations in hormones, creating these unwanted symptoms. So let's start with estrogen dominance. So the term estrogen dominance was coined by a pioneer in bioidentical hormones, Dr. John Lee. And it basically means a relative lack of progesterone compared to estrogen. Now, this can occur at any age. It is more commonly seen in perimenopause when hormone levels, especially progesterone, fluctuate widely, dipping in most instances, of course, leaving estrogen unopposed, creating those unwanted symptoms. And if you notice here, 75% reduction of progesterone is seen from age 35 to 50, and that's usually the perimenopausal phase. And this is where a lot of times we see those symptoms that women generally have and need to come in for an evaluation. So, some common signs and symptoms of estrogen dominance, we do see cyclic breast tenderness, pain or fibrocystic breasts, uterine fibroids, PMS moodiness, especially with irritability, tearfulness, or mood swings, PMS-related headaches, weight gain around the hips and buttocks, which is one of the biggest issues that women have generally around that perimenopausal stage. They start gaining weight around the middle, and that is one of the biggest reasons why they come in as well. Signs of low progesterone, also like difficulty sleeping, they have shorter cycles, spotting, MS problems, polycystic ovarian syndrome or PCOS, and of course, the perimenopausal age range 35 to 55, to where they're experiencing heavier periods, weight gain, hot flashes, night sweats. So let's go into the luteal phase deficiency. And this is where there is low progesterone level in the luteal phase of the menstrual cycle. So with luteal phase deficiency, there is an insufficient amount of progesterone to maintain a normal secretory endometrium to allow for a normal embryo implantation and growth. So here it can impact fertility. It is considered under the umbrella of estrogen dominance, not because there are high levels of estrogen in the body, but because the levels of progesterone are low in relation to the estrogen during the luteal phase. And this can occur at any age, and it occurs in about 4 to 8% of cycles in women with regular cycles, but it is most common during perimenopause when women are transitioning out of the reproductive years. And of course, with perimenopause, progesterone levels are the first to decline. And so this causes issues like irregular periods, heavier periods, premenstrual spotting, premenstrual headaches, and due to the higher unopposed estrogen levels, this can also contribute to insulin resistance and, of course, storage of energy as visceral fat, or basically it's just fat around the tummy area, and weight gain. And here are just some common causes of luteal phase deficiency. You've got low calorie or fat diets, over exercising, especially combined with low calorie diets, high stress levels, chronic stress, high insulin levels are also associated with low progesterone production, such as in conditions like PCOS. And of course, progesterone levels often drop with age, as in perimenopause. Hypothyroidism, which is an underactive thyroid, and changes in hormones like estrogen and progesterone, often seen in perimenopause and menopause, can affect overall hormone functioning, including thyroid hormones. And estrogen is responsible for stimulating thyroglobulin. So thyroglobulin is a precursor to thyroid hormones. So excessive estrogen causes goiters because of high levels of thyroglobulin. And likewise, too little estrogen results in low thyroglobulin, which reduces thyroid function. Adrenal stress can increase TBG and reduce thyroid function. So when there is chronic stress, prolonged high cortisol levels can make it harder for your liver to clear estrogen levels. This excess estrogen increases TBG, thyroid binding globulin, which is a carrier protein that transports thyroid hormones throughout the body. So when thyroid hormone is bound to TPG, it becomes inactive. So as a result, there's a reduction in thyroid functioning. And the symptoms of thyroid problems and perimenopause often overlap, and so they have a compounding effect. So sex hormones and thyroid hormones have to work symbiotically for proper functioning. So this is a chart showing the symptoms of both high and low thyroid, as well as perimenopause and menopausal symptoms, and how these symptoms can overlap. So in order to identify the imbalances, the specific imbalances in the body, it is best to test to see whether it's thyroid or if it's just transitioning into menopause. And the only way to know is through testing. So, another common hormonal imbalance in women is HPA axis dysfunction, which is dysregulation of the body's stress response over time. And with chronic stress, you can have high or low cortisol levels, causing adrenal insufficiency or burnout. And some of the common symptoms are fatigue, insomnia, weight changes, low blood pressure, difficulty dealing with stress. So, prolonged stress creates the following hormonal imbalances. So, with high cortisol levels, it contributes to a myriad of medical issues such as high blood pressure, mood changes, low libido, weight gain, irregular periods, and prolonged stress can interfere with other hormones, of course, such as testosterone. High cortisol levels can cause testosterone levels to decline. And although testosterone is the primary male hormone, women have it too. And it's just as vital as estrogen or progesterone. And in women, testosterone helps to maintain muscle mass, helps support normal cholesterol levels. It keeps metabolism and weight in check, produces better sleep, supports libido. So testosterone can be lowered as a result of higher stress. Also, stress lowers estrogen levels. And of course, estrogen is responsible for 400 different functions in the female body. And so when that's lowered, we get weight gain, hot flashes, night sweats, fatigue, moodiness. So with excess cortisol, it inhibits progesterone production. So the biggest inhibitor to progesterone production is chronic stress and elevated cortisol levels. In times of stress, the body tends to switch gears by increasing cortisol to keep you alive. I mean, it doesn't really care about making sex hormones at that point. And of course, low progesterone levels can cause all the main symptoms that we discussed earlier in estrogen dominance. And chronic stress can affect other hormone systems as well, like thyroid hormones, which we've discussed, ghrelin and leptin, which regulate appetite. It also affects melatonin. This could increase restlessness, insomnia, and stress can also affect an insulin, contributing to type 2 diabetes. And of course, a very common hormonal imbalance is the perimenopause menopausal period. And this is the transitional period in a woman's life. And according to the Cleveland Clinic, hormonal changes are seen 8 to 10 years ahead of menopause, and it can occur between the ages of 35 to 55. And here are some common symptoms of perimenopause: irregular periods, periods that are heavier or lighter than normal, worse PMS before periods, breast tenderness, weight gain, hair changes, heart palpitations, headaches, loss of sex drive, difficulty concentrating, focus, forgetfulness, muscle joint aches, UTIs, fertility issues, trouble with sleep. And it's interesting that these symptoms overlap with those of estrogen dominance. Okay, so let's get into testing. And these are some different methods. You've got serum testing here, saliva testing, urinary testing, and blood spot testing. So let's start with serum testing. Serum testing has long been accepted by the conventional medical community as the standard for measuring hormones. There's a load of literature on PubMed. With serum testing, it shows circulating bound and unbound fractions of hormones. So for steroid hormones to be detected in serum, they have to be bound to circulating proteins. And in this bound state, they're not able to fit into receptors, so they can't be delivered to tissues. So it measures the protein-bound biologically inactive hormone levels in the body. Serum sample shows a moment in time, unlike saliva testing, where it shows increments of time and looks at patterns. This may lead to misleading results in which hormone levels appear to be normal or even high normal because of the abundance of bound hormone. But it is utilized by many practitioners for baseline pre-hormone replacement. If using topical hormones like estrogen or testosterone, using serum testing to monitor can result in an overdosage. So if the free hormone level is low, the patient can be functionally deficient, even with a normal total hormone level. So serum testosterone in this instance is an exception in that it is commonly available as both total and free. And so it could be useful in assessing hormone balance. But again, we're not going to go into the nuances of these variations in testing. So look for that in later webinars. So if you're using topical hormones like estrogen or testosterone, using serum testing to monitor, overdosage can occur because hormones applied on the skin are underestimated in the blood. So what are some pros of serum testing? So there's a simple collection with relatively little patient involvement, has well-established reference ranges. It's ideal for testing peptide hormones like FSH, LH, prolactin, fasting insulin, thyroid hormones like reverse T3, as well as thyroid antibodies. And it's also used to measure sex hormone binding globulin. Some disadvantages: it has limited utility for testing sex hormones because for most sex hormones, no distinction is made in serum between bound and free hormones. And because hormones are secreted in a pulsatile manner over the course of the day and night, it's difficult to know whether the levels in serum represent a peak, a valley, or something in between. So this presents a difficulty in monitoring treatment. And it's not possible to know whether today's test was drawn at a similar point of hormone secretion as a previous test. Estradiol, estrone, estriol, and progesterone are reported as total hormone, and free hormone assays are not commonly available. And estradiol is the female hormone most commonly measured in serum, although estrone is also available from many labs. But serum estriol testing is not routinely performed, and it's a very important weaker estrogen, generally considered protective, since it binds to the receptor estrogen beta, which is understood to increase differentiation and decrease differentiation of cells. And testing is the snapshot nature of a single point testing. So it's just a moment in time. It doesn't typically allow for the measurement of estrogen, androgen, and adrenal metabolites. And so it doesn't really show what the hormones are actually, how they're processing in the body. And if you're using topical hormones like estrogen or testosterone, using serum to monitor, again, overdosage can occur here. Saliva testing. So in the past decade and a half or so, saliva testing has gained in popularity among practitioners in functional medicine, like naturopathic physicians, chiropractors, acupuncturists, pharmacists. Some advantages of saliva testing: it is non-invasive, and it's also accessible to practitioners who may not be practicing in states where they're not licensed to order blood tests or draw blood. It allows for multiple collections over a period of a day or month, which can actually show us abnormal hormonal patterns, such as a shortened luteal phase. And it's also really good to use to evaluate the balance and flow of estrogens and progesterone in women who are still having menstrual cycles, to pinpoint where their deficiencies are and where the fluctuations may be occurring. So those patterns can really help us to come up with a good therapy plan for them. Also, it evaluates cortisol secretion patterns in multiple samples over a day and evening. And in certain medical groups, it is considered the gold standard for cortisol testing. Also measures free hormone, and the multi-point versatility makes it a better measure than serum for evaluating unsupplemented hormone status. Some disadvantages: saliva production can be difficult for some patients. So there are restrictions regarding eating, drinking, gum chewing, makeup, topical application, toothbrushing. Often with saliva testing, it is done, especially with the first big tube in the morning. There is no eating or drinking, but if a person is parched, they can actually rinse their mouth out with water and start collecting 5 minutes later. Microdamage from toothbrushing can result in elevated salivary testosterone levels for up to an hour after brushing, even in the absence of visible signs of bleeding, such as the pink toothbrush. And saliva can only be used to evaluate steroid hormones and not the metabolites. Peptide hormones such as growth hormone and thyroid are, of course, not available in saliva testing. Some considerations with salivary testing: it is greatly affected by the use of exogenous hormones. So if patients are on topical hormone therapy, they have to be able to test according to the requirements of that particular testing lab. And usually they're done 12 to 24 hours from the time of application of their hormones. 4-point cortisol is greatly encouraged with salivary testing to see if there's any HPA axis dysfunction. And of course, cortisol directly impacts hormone balance. So it is greatly encouraged to do a 4-point cortisol with salivary testing. It is a much better indicator of what's happening inside the cells compared with serum. With dried blood spot testing, it involves a finger prick collecting blood drops on a filter paper, and then the blood is then dried, stored, shipped to the lab for testing, which stabilizes the analytes. The advantages over serum testing is that it's more convenient for patients and practitioners. Analytes are stable in dried blood, allowing it to be sent via regular mail without a coolant, and as a result reduces the weight, saving on shipping costs. The test can be ordered by the practitioner, sent directly to the patient's home, and home collection of blood circumvents the need for the collection to be performed by a phlebotomist at a clinical lab or physician's office. And working with dried blood on the filter card makes it easier to receive, process, store, and save the sample longer in case retesting or add-on testing is deemed necessary. So it's overall more convenient, a lot easier to do. And as far as for the patient, it's much easier than having to go to a lab. The disadvantages: it does represent the total steroid in interstitial fluid mixed with capillary blood and not the free fraction of steroids that are bioavailable to tissues, as with saliva. So it does not really show what's actually in tissue. And usually these hormones in tissue are free and active. So there are people who just do not like to stick their finger. And they also have an issue with being stuck by a phlebotomist as well. So this could be difficult for these people. Applying topical hormones to the fingertips within 24 hours of a finger stick collection can lead to false high test results. So the patient has to remember not to apply topical hormones to the hands, the wrists, or the lower arms before collecting a dried blood spot. The blood spot testing is more ideal for measuring steroid hormones like insulin, blood lipids, vitamin D, your thyroid hormones, essential and toxic elements, but it does seem to have advantages over serum since it does eliminate the need for a blood draw. Urine testing. So it measures the downstream metabolites, and this is where it measures the breakdown products of sex hormones, including circulating estrogens in the body, as well as other breakdown products. It's a really good method to assess the way the body's metabolizing and excreting hormones. And hormones in urine are reflective of the combination of both the endocrine production and the peripheral production of hormones and their metabolites. It's also a great way of assessing the catabolic versus the anabolic state in the body. So it's good to assess the balance between the wear and tear versus the rest and recovery in the body. So for optimal health, you want your anabolic state to be higher than that catabolic state for optimal health. And this is a really good way to assess that through urine testing. Urine testing also can show imbalances in the HPA axis. So stress alters the HPA axis balance. So it decreases the production of androgens and estrogens. Stressors tend to pull pregnenolone and progesterone towards the production of cortisol, which could be a detriment to the androgens like DHEA and testosterone downstream. And without those androgens, of course, there's less conversion into the estrogens. And so the impact of stressors to cortisol can impact both androgen and estrogen levels downstream. Also, increased cortisol production can impact thyroid and insulin levels. So, cortisol can lower thyroid production and increase insulin levels. And stress alters the HPA axis, and this can lead to an increase in the mineralocorticoids, which can stimulate the renin-angiotensin system that leads to tachycardia and elevated blood pressure. So it's all about that anabolic catabolic balance that has to be maintained for a healthy body. It's also available as 24-hour urine or dried spot testing, and urine hormone testing allows for a full day perspective on hormone production. It's important because some hormones are produced primarily late at night, early in the morning, or in pulses throughout the day. So a single blood draw or saliva sample can't account for this variability. So finally, urine testing measures free and conjugated hormones, which provides a true measure of bioavailable hormones. Neither serum nor saliva provide this. So can urine testing be used to monitor HRT? Well, this is a hotly debated topic since urine is a reflection of blood, since it is a filtrate of blood. You have blood levels and then there's excretion into the urine. So many clinicians assert that urine testing can be used to monitor orally administered hormones. But as far as topical hormone replacement therapy, many clinicians indicate that urine testing should not be used to monitor hormones since topical hormones are underrepresented in blood and urine is a filtrate of the blood. So it might well also be underrepresented in urine. So there's just varying opinions out there for best practices. So it's just really best to choose testing options that are going to best represent the specific need of the patient. So what are the advantages of urine testing? One of the advantages is it measures downstream hormone metabolites, which of course helps the practitioner to be able to see the hormone bioavailability and metabolic pathways, which can indicate risk factors for hormone-dependent cancers. Another advantage, urine hormone testing allows for a full day perspective on hormone production, since there are pulses, hormone pulses throughout the day. And it also measures free and conjugated hormones, which provides a truer measure of bioavailable hormones. And so dried urine testing has its advantages over 24-hour urine collection. Since it is a simple sample collection, the procedure is simple and it can be completed at home. So a lab grade filter paper strip can be saturated with urine either by dipping it into the urine that's been collected in a cup or by urinating directly onto the strip. So it takes very little urine to saturate the strip. There's convenience of shipping. The strip has to be dried for at least 4 hours and then placed in the collection kit box and mailed back to the lab. So no refrigeration is required and shipping costs are low since samples can be sent in regular mail. And this makes shipment to the lab more convenient. It allows for shipments from anywhere in the world without any preservation with the frozen or ice packs. Liquid urine is subject to bacterial contamination, and so it has to be shipped refrigerated or frozen. And with sample stability, multiple collections can easily be collected at specific time points throughout the day, allowing for the evaluation of circadian rhythm of hormones like cortisol and melatonin. So these specific time points required are convenient, avoiding the risk of missed collections. Some cons: the 24-hour urine collection is more cumbersome and it is inconvenient and messy, and accuracy is dependent on collecting all urine in a large plastic jug during the course of the day, measuring the total volume of urine collected and carefully pouring a small amount of the entire contents of the 24-hour collection into a smaller vial for shipment to the testing lab. So urinating directly into a plastic jug is not a simple task for most women, and collections are often missed, especially those associated with a bowel movement. Dehydration or excessive fluids can affect results. Not all urine hormone testing methods are equal, so serial single point urine collection does not account for individual differences in hormone secretion. And urine testing cannot test both free, which is active, and total levels of testosterone. So here's an example of how urine testing can be a benefit. Urine testing assesses both the parent hormones and their corresponding metabolites. So it reveals how the body is breaking down key hormones like estrogen, progesterone, androgens, cortisol, and melatonin. And of course, this testing gives insight into whether we're fully detoxifying our hormones, which is very important because some hormones can be carcinogenic if they don't break down properly, so leaving us more at risk for a variety of diseases like cancer. Unfortunately, things don't always go normally. The liver's ability to properly metabolize estrogens, for example, has been found to affect the risk of breast cancer. Depending on which of the metabolic pathways predominate, too much of certain harmful estrogen metabolites, like the 4-hydroxyestrone, can build up, and these, of course, have been found to correlate with breast and other hormone-dependent cancers. So the estrogen metabolism test measures the ratio of 2-hydroxyestrone to 16-alpha-hydroxyestrone in a random urine sample. So evidence indicates that the ratio is relevant as a risk factor for estrogen-sensitive diseases, including breast and cervical cancers, as well as some autoimmune diseases. So testing for the urinary levels of 2-hydroxyestrone and 16-alpha-hydroxyestrone provides valuable insight regarding disease risk. And improvements in the ratio can be made through dietary recommendations and supplements. Research indicates that 16-alpha-hydroxyestrone stimulates proliferation or cell growth, sometimes contraindicated in certain diseases, where 2-hydroxyestrone has been shown to be protective against or lessen the risk of cancer. 16-alpha-hydroxyestrone is elevated in those at risk for breast cancer, as well as other conditions associated with hyperimmune activity, such as systemic lupus and rheumatoid arthritis. So some key hormones to test for women's health: your sex hormones like estrogen, progesterone, testosterone, your DHEA, DHEAS, which is the sulfated form of DHEA, your cortisol, like your 4-point cortisol, so that you can see the circadian rhythm to see where your stress levels are at. Your thyroid hormones, especially thyroid antibodies, should be included in that to see if there's any potential autoimmune involvement. And your SHBG, which is sex hormone binding globulin, controls testosterone effects in both men and women. And so it's almost like a sponge, that soaks up androgens. And it's really good to test SHBG to monitor testosterone levels. So I just threw this table in here that outlines the testing options for this particular patient, who is a 52-year-old female with irregular cycles and other symptoms. I know with the purpose of this particular webinar, we're not going in depth into case studies, but I just wanted to throw this one in there because it looks like a really good example of the testing modalities that we've discussed, and it has really good commentary explaining the rationale for the types of testing that would be appropriate for this particular patient. And hopefully this is something that could be useful to see if you can glean any information that may be useful or helpful for your patients. And here are some reference ranges based on the types of testing. These are normal lab values for sex hormones. This is the serum reference ranges here, and these are saliva reference ranges, dried blood spot reference ranges, and hormone and urinary metabolite reference ranges. And here is the dried urine reference ranges. So this is a really good table that gives us a guide to steroid hormone testing in different body fluids following different routes of hormone administration. And these are just recommendations based on the different types of hormone therapy as to what types of hormone testing is appropriate. And here are some references that may be helpful. Okay, so some hormone testing considerations. So appropriate baseline testing should be performed before hormone restoration therapy is considered. It's always good to have baseline levels to see where a person is at before considering hormone replacement. Follow-up testing typically done 90 days after the initiation of therapy, and that can vary based on the patient's symptom response. And once the symptoms are managed and physiologic levels are established, retesting can be done at the practitioner's discretion. So usually that's anywhere from 6 months to a year. Premenstrual or perimenopausal women should test on days 18 to 21 of cycle, and all other patients can test on any day. Cortisol testing should be done on a day of average stress. Okay, so we've got some more hormone testing considerations. Pricing is a big one. So cash pricing for lab tests can vary anywhere from $39 to $800 or even higher than that, depending on the type of testing that's being ordered, whether the hormones are being ordered individually or if a panel or a comprehensive profile is being ordered. So it really is dependent on what the patient needs, and the more tests that are ordered, of course, the more expensive it is. And serum testing, depending on the plan, insurance generally covers serum testing, but they don't seem to want to cover salivary, dried blood, or urine testing. Hormone testing is also very controversial, and it's very individualized. There are many differing perspectives on hormone testing, and it's based on training, experience, and research. And it truly boils down to what testing is best for the patient and their particular need to get them to that hormonal balance and a better quality of life. And keep in mind to use appropriate testing that correlates with the type of hormone therapy given for the best dosage tweaking for optimal results, and consistency of the type of testing is helpful for monitoring therapy. So, for example, if you decided to use salivary hormone levels as baseline and the patient is put on topical hormones, it would be best to follow up with salivary testing to evaluate whether dosing was appropriate and dose tweaking can be done. And salivary testing should be used for monitoring these topical hormones ongoing. So some more considerations: so much testing variability that can affect patient care, like differing reference ranges among different labs, different clinical interpretations of test results, misdiagnosis, delayed diagnosis, or suboptimal patient care, repeat testing when patients change doctors or are referred to specialists, repeat testing with different labs. There is no one-size-fits-all approach to hormone therapy and management, hence, no one-size-fits-all testing. And there's not one single testing method that is viable for all situations. Serum, saliva, dried blood spot, and urine testing can offer important insight into a patient's hormonal status. And each has a set of clinical strengths and limitations, such that a combination of testing methodologies may occasionally be necessary to get all the pieces of the health puzzle in order to devise a plan for optimal hormonal balance. So ultimately, with testing for hormones in women's health, we are looking at finding a balance, symptom relief, prevention of inflammatory diseases, and improvement of quality of life overall. And testing provides greater insight by getting the data where we can make more educated protocols designated for that specific patient. So we have to look at that bigger picture in order to help the patient to reach that state of balance. And even in patients who are doing well, testing can give us a sense of what the levels are when they're feeling their optimum for comparison's sake. Some lab testing companies that are out there, ZRT Labs provides salivary, dried blood spot, dried urine, and serum testing. The Dutch test, they provide salivary cortisol, dried urine, hormone metabolites mainly. Genova Diagnostics, they provide serum, salivary, and 24-hour urine testing. Doctors Data, they provide salivary and urine hormone testing. The Mosaic Diagnostics, they were the Great Plains Labs. They changed their name in 2023 to reflect more than just that Midwest reference. And they provide salivary hormone testing. And Meridian Valley Lab provides the 24-hour urine and dried urine testing. So here are some resources that hopefully can be helpful. So just to keep in mind, hormonal balance is multifactorial, and many symptoms of hormonal balance overlaps those of other medical conditions. So testing is vital to put the pieces together in order to have a plan for optimal hormonal balance. Thank you for listening, and I hope that this information was helpful. And tune in to our next webinar coming soon.